everyone. I'm Lisa Reams, Vice President for Programs and Services at Pima Council on Aging. And this is episode 10 and the season finale of our show, PCOA Voices. I'm so glad you could join me today. We keep all the prior episodes of PCOA Voices both on our Facebook page and on our website, pcoa.org. So please go check them out if you have missed any. And if you're tuning in to our live broadcast, you can even interact with us via the chat feature if you'd like. PCOA staff are here to answer your questions, and they'd love to just say hi to you. Now, the purpose of PCOA Voices has been to inform you, engage you, and have some fun along the way. We wanted to stay connected with you, even though we're still all a bit physically separated right now. So hopefully you've experienced all of that in your journey on PCOA Voices with me. And speaking of walking the journey together, that's what our team of family caregiver support specialists does here at PCOA. They walk the journey side by side with family caregivers to support them and let them know that they're not alone. I was surprised to learn that 1 in 4 people is currently acting as a family caregiver, and that number is quickly approaching 1 in 3. So this is an issue that really impacts a huge number of people in our community. And I want to explore more about the realities and the challenges of caring for a loved one and all the ways that PCOA can help. So you've met them all briefly in our caregiving tips of the week in previous episodes, but back to join me for a group discussion on the topic of caregiving are Deborah Waring, the coordinator of PCOA's Family Caregiver Support Services program, and 3 of our 4 family caregiver support specialists, Amber Jin, Jerry Morrison, and Zuri Reyes. So welcome to all of you. I'm so glad you were able to join me on Voices today.
Thank you for having us
Lisa.
here.
Thanks for having us here.
You know, one of the things I've heard over the years, just to kind of jump us off here, is that it's really hard for us sometimes to connect with family caregivers because so many people just don't identify that way. So like maybe if people are caring full-time for a loved one, a parent or a spouse, they may easily identify with that name, but there are so many other scenarios too. In addition to spouses or children, they could be siblings or friends or neighbors or even members of a church congregation. So you may be a caregiver and you just haven't even thought about yourself that way. Deborah, can you start and give us all an idea of what it means to be a family caregiver and what types of things family caregivers do?
Sure, Lisa, you're so right. And caregiving has been talked about as being a universal occupation because most of us at some point in our lives are caregivers. It usually starts out with folks having small things to do, such as you see the neighbor and they're struggling to get the garbage out to the curb, or maybe their driving is getting slow and hesitant, and so maybe they need a little help getting to the grocery store. I know when I was caring for my mother, she'd call me and say, you know, I got this bill or this statement from the insurance company and I don't know what to do with it. So we would go over those types of things. So it's variable, and church members can be caregivers as well as neighbors and family and friends. The thing that's important to know is that caregiving usually starts out where it's real manageable, but after a while, the demands of caregiving can start to juggle with the things that we need to do in our own lives. So that can be quite a challenge.
Yeah. You know, oftentimes people think of caregivers as people who get paid to care for someone, and they might feel that what they're doing isn't considered a job because they're taking care of a family member or someone they love, and they feel that, you know, they're doing it either out of love or a sense of duty or whatever that might be. Can you talk about that a little bit?
Sure. Well, of course, there's 2 kinds of caregivers: those that go to school and they take tests and they learn how to give what would be considered professional care. And those are in the medical care settings. And the others, what you mentioned, is the informal caregivers that aren't paid. You had mentioned that 1 in 4 people are caregivers and that it's moving closer to 1 in 3. Something that might be of interest to you is that 1 in 4 caregivers are spending more than 40 hours a week in their caregiving role. So when you talk about a full-time job, that's a 40-hour position right there, and they're not getting paid to do that.
I'm guessing there's lots of them that are trying to hold down jobs at the same time, in addition to other
Exactly.
they have. And, some people are caring for someone in their home and full time, and other folks might just be popping in on a friend or a neighbor occasionally and checking in. So it seems like it could really run the gamut of all of those types of scenarios.
Exactly. So you've got someone with a full-time job, and they've got another full-time job caring for someone as well.
Right.
That's a real challenge.
That seems real hard to manage. Yeah. And I'm guessing that there are several challenges common to those in these informal caregiving roles. Amber, you've been providing support in this area for quite a while now. Would you tell us what some of those challenges are that caregivers experience?
No. Oh, absolutely. Yeah. There are a lot of challenges that are unique to family or informal caregiving. And like you mentioned, about a third of all caregivers are working. So in addition to everything else they're trying to do for themselves and caring for a loved one, they're putting in hours to earn some money. One of the big changes, I think, is that relationships and roles change. So it's not a job. You're not caring for a stranger. You're caring for somebody you know and care about and love. And suddenly you're not just a son, daughter, spouse, friend, neighbor. You are monitoring and directing and delivering personal care, which can be awkward for both parties, and things like that change the dynamics of relationships. And you also are seeing somebody you love decline. They're losing a lot of their independence and abilities. And in the case of people who are dealing with chronic pain, that can be really distressing to not be able to provide total relief. So there are a lot of emotional stressors that come into play when you are caring for a loved one. Lifestyle changes, your routine changes. You're suddenly thinking about other people's needs. You're providing safety, health and well-being, and quality of life. You're improving the quality of life. And all of those things take time and effort. So suddenly your tasks and everything you're doing already, which it should include taking care of yourself, has been your schedule has been inundated with so many things, and there are never enough hours in the day. I think any caregiver would agree with that. And most would also agree with they don't get enough sleep, so they don't get enough sleep or downtime. And those are both really vital for emotional, mental, and physical health. And so our big concern, one of our big concerns, is that you start to see depression, anxiety, fatigue. There's hypervigilance, so it's this chronic stress, and we worry about burnout. So I could go on and on about all of the challenges that they face, but it's a really important role, and it is a very rewarding role. And that's why we're here. We're here to offer the support and education and information, resources, suggestions that can help them do this sustainably, So we're definitely here to help them walk the journey, like you said.
And that does sound like a lot of stressors potentially on somebody. And I'm guessing a lot of folks don't know what services are out there to be able to help them, and they try to figure it out on their own,
Right.
or aren't comfortable reaching out to ask for help. So either they don't know it exists, or they aren't comfortable reaching out. So I think it's really important that we let folks know what we have here at PCOA that can be helpful for them. Zuri, if I could jump to you, can you tell us about a couple of the services that we offer in our family caregiver support program?
Yes, absolutely. So Amber already started us off a little bit with that, talking about some of the resources that people can have access to. And the way that we do it is we have a service that I would say it's the bread and butter of what we do, and it's the one-on-one consultations. where someone can request to meet with a caregiver support specialist and discuss their particular situation, and based on their very specific situation, see what options are available. And sometimes it can be something as simple as not knowing that there's a resource out there in the community, and hey, here's the information to get tapped into it. Sometimes it is just, you really just need to bounce off ideas of, say, how do I get my loved one to stop driving? Well, have you tried this or that? Sometimes it is just some validation and knowing that, yes, this is something that you're doing, that you're pursuing the right track. And you are on the right track. And sometimes we just need someone who knows what they're saying to hear that, to say that to us. So so those consultations are at the core of what we do. But in addition to that, we also have a respite program. And the respite is defined as an opportunity to give the caregiver a rest. Because one of the things that Amber talked about, a big concern is caregiver burnout, where you are just no longer able to perform the caregiving in any capacity because you're just it's gotten so overwhelming, you're so drained. So one way to try to avoid that is to provide some time off from that caregiving position so you can center on caring for yourself. And we have 3 different ways of respite that we do here at PCOA. We have traditional respite, where it is when you have a direct care worker from an agency come in and provide some respite in the home. We have out of the home respite in the way of adult daycare. So there's some adult daycares around town and in other areas of Pima County, such as Aguarita, where you can have your loved one attend a class there, or a day there, so that you can have some rest. And the third one, and newest one, is our Friends and Neighbors program, which is a new program that we're rolling out. And the idea is that as the caregiver, you get to choose who provides some rest for you. And it is up to you, you have the flexibility to find someone that you know and trust to provide some assistance with your loved one, and we can cover some of the financial burden of that. So we have these 3 different modalities, and we absolutely encourage caregivers to contact us and see what either for the one-on-one consultations, or to see if respite is something that they could qualify for.
That was a great overview, Zuri. Thank you. And I understand that you can help people that are more comfortable speaking in Spanish as well. Is that accurate?
Yes. We do have a Spanish speaker, so I'm more than happy to speak to folks in English or Spanish.
Wonderful. Thank you. That's awesome. Jerry, I know that you kind of oversee the other couple parts of what we offer in family caregiver support. Can you talk about those services?
Absolutely, Lisa. Thank you very much. I am responsible for our Family Caregiver Support Group program. Right now we have 11 groups that meet on various days, various times throughout the month. They are designed to be a monthly support, but with all of them being on Zoom, there's no travel time to get to one that might be more convenient instead of one that's actually meeting or would meet in your neighborhood. And these groups, even though they're on the internet in a format just like this on Zoom, they're designed to be confidential. They're designed to be a safe space for a caregiver to talk about the frustrations of changing relationships, the frustrations and grieving of watching your loved one's condition deteriorate, and you really have no control over being able to stop that or change that. But you become their advocate, and being able to get ideas from other people that are also caregivers for a family member or a friend, and being able to tap into resources like was mentioned earlier that you probably didn't even know existed, but somebody else in the group mentions that it was helpful for them, and then we can get access to that for you. Another aspect of my role is right now revising our family caregiver training program called Caregiving Essentials. We're revising that into a video-based program, and we're almost ready to have them all launched onto our website. There'll be 12 different topics for a caregiver to watch. There'll be a download of the handouts, and then every so often we'll have a 90-minute Zoom meeting where you can come and ask questions about the videos and make sure that the information we're giving is applicable to your unique situation.
That's great. If I could ask you a couple of follow-up questions. So for support groups, you said that they're being held on Zoom in this sort of a format. What if somebody doesn't have the technology to do that, or they don't have a camera on their computer or whatever? Are there ways they can participate still?
Absolutely. Zoom has a phone number access where you would call a phone number for Zoom, and then the robotic answer will prompt you to enter your meeting ID number for the meeting that you want to attend. And on a screen like this, you'll just show up as a phone receiver.
Gary appears to have frozen. That's okay.
You'll be able to hear and participate just as normal.
Okay. We lost you for a second, but you came back. Okay. Well, I had one more question too about the training. I know one of the aspects of training that we've always done is some real hands-on training with folks, like how to use different durable medical equipment or how to do various tasks. How are we doing that right now? What are we doing?
Right now, our Pima Care at Home has offered to do one-on-one for an individual situation and for very specific questions. And the people going into your home are trained in how to use the personal protective equipment and make sure that you and your loved ones are safe during this pandemic.
Okay. So if a caregiver needed some assistance like that, you could help connect them with that.
Yes.
How would someone reach you if they're interested in a support group?
Sure. Absolutely. The first line is through our helpline, which is 790-7262. But you can also call me directly at 305-3405.
Okay. And the schedule of support groups, is that on our website?
It is. It's also published every time in the Never Too Late. And once you're a registered participant, I put you on an email list, and several times throughout the month, I'll send out emails with the upcoming group information and login information. And when we talk the first time and get you registered, I'll send you the monthly schedule as well. But then every month you'll get the new schedule too.
Okay. And Zuri, if I could jump back to you for just a second, the services you talked about, the one-on-one consultation and respite services, those are ones you could access by calling our helpline. Is that correct?
Absolutely. You can access those by calling our helpline and requesting to be connected, just explaining your situation and requesting to be connected with the caregiver support services.
Okay, awesome. Thank you. Just want to make sure everyone knows how to reach us. Well, thanks for that overview of all of the services. I know there's a lot in there and we have a lot to offer folks. I hope they don't hesitate to reach out for help. I heard that November is officially Family Caregiver Month. Deborah, can you kind of wrap us up and tell us what activities PCOA is offering for Family Caregiver Month and how people can get involved?
I'd be delighted to. So annually, we celebrate National Caregiver Month. And because of the pandemic, this year we're choosing to do what's a drive-by event. It's going to be at Reed Park here in town. It's going to be November the 18th, which is a Wednesday, and that's from 10 to 12. So it'll give people an opportunity to get out and about, stay safe by staying in their cars. And the event's called Creating Comfort and Purpose. What we'll do is have it very designated as to which direction they go in the flow of traffic, and we'll give maps after people register for the event. It's going to be limited to 100 informal family caregivers. So we'll do registration in 2 ways, which I'll talk about here in just a moment. But we'll have activities such as little entertainment as they're in their car driving by different stations. We'll have some little food items that are going to be in the bag, a lot of activities that they can do at home, and goodies. Always chocolate. We'll be sure to include some chocolate for folks. And then we'll also include materials that we think are useful, such as we have a book called the Resilient Caregiver Book, and it has 12 chapters that caregivers tend to love and be able to refer to for their caregiver needs. So that's the event for this year. We're partnering with the many community partners in this. So you'll get to, I won't spoil the surprise, so you'll see some of them when you show up. But in order to register, there's 2 ways you can do that. The first is to call PCOA and speak with Lori. Her phone number is 258-5064, and she'll be glad to register you over the phone. The second way we'll do this is through Eventbrite. And on the screen, you'll see the Eventbrite link that you can go and register. So we hope you'll join us. It'll be a fun event for this year. And we hope you take good care of yourself. See you there.
Can I ask you one follow-up question on that? You mentioned the How to Be a Resilient Caregiver kind of handbook that we have. If folks aren't able to come to this event to get one, is that something they can get another way?
Certainly. When you call and talk to Lori, tell them you won't be able to attend the event, but you're still interested in some of the materials that we have to share. And we've got volunteers that have mentioned that they would be willing, in some cases, to make home visits and drop them off on a porch. So we'll get it to you some way. We'll mail it to you, or we'll get it to your porch if that's something that's useful.
It's also available on our website under Caregiver Resources.
Thanks, Jerry. Yeah, it's electronically available. And we break it down by each chapter, so it's not overwhelming when you go to the website. You
Right.
see time.
Perfect, thank you. Well, there's so many good resources here, and I so appreciate you all for what you do every day and walking the journey with family caregivers. You're an amazing group, and I appreciate everything you guys do, and grateful for you, thankful for that you're here, and thank you for joining me on Voices today.
Thank you. I'm happy to be
Thank
here.
you, Lisa.
Yeah, absolutely. And now I would like to welcome Raver Meal, the coordinator of our Rights and Benefits program, with a tip about keeping all of your important documents in order.
Hi, my name's Ray, and thanks for tuning in today. I'm here to give you a little bit of a nudge about some important documents that it really is good to have on hand that you might not put very much thought into having available. And if you don't, and you need them in a pinch, it can take quite some time to get your hands on them. One of them is your birth certificate. And I'm not talking about the folded up, yellowed one that your mom gave to you when you left the home as a young adult. I'm talking about a certified birth certificate from the state where you were born. Also, do you have a copy of your marriage license handy? Do you know where it is? Or perhaps a divorce decree, your Social Security card, or your Social Security award letter. Also, if you maybe changed your name on a whim 10 years ago, do you have the documentation for that handy? These are all things that you might need if you are applying for benefits that you might need at a time of urgency, or if you even need to go do a banking transaction and say you're from out of state and you have an expired Nebraska driver's license and you go to your bank and you want to handle a transaction and they tell you that they're very sorry, but they can't do it with your expired license and you need a current Arizona ID. And while it's an inconvenience, you're like, well, okay, I guess I'll go to Motor Vehicle Division and I'll go get my Arizona ID. But then you get there and they tell you, oh, well, gee, we can't do it based on your expired Nebraska driver's license. we need to see a copy of your certified birth certificate. And down the rabbit hole you go. So please think about having these documents, getting them now if you don't know where they are, or if you don't have a birth certificate at all. It's not hard to either Google the state where you were born and find their vital records department, find out where you can pursue getting that. If you don't have access to a computer and aren't quite sure what to do, please feel free to call our helpline at 520-790-7262. You just don't know when you might need one of these forms of documentation. So I hope you'll collect them, and I hope you put them in a safe spot. A fireproof, portable, carry-along luggage kind of safe is a perfect thing. By the way, please don't carry your Social Security card in your wallet. It's really tough to get a duplicate, and if it gets lost or stolen, then you can be a bigger target of identity theft. Take care, and thanks for being with us. Bye-bye.
Thank you, Ray. You're so knowledgeable and always have such great practical advice for folks. We're lucky to have you and your staff as resources. And now back to Anchor, the final interview of this season of Voices. I would like to once again welcome Mark Clark, President and CEO of Pima Council on Aging. Hi there, Mark.
Hi, Lisa. It's great to see you.
Thanks. You know, I had you on a couple of times way early in the show, and I know when I had you on before, we were only a couple of months into the pandemic, and as you like to say, we were building the plane while we were flying it. Hopefully, since then, we've built the plane a little bit further, and I'm curious from your perspective now, looking back over that time, what have been some highlights for you of PCOA's involvement in the lives and safety of older adults since then? What are some things you're really proud of?
Well, Lisa, it's just, I think the thing that I'm most proud of is the wonderful flexibility and accommodation that our colleagues here at PCOA have shown as they have been flying or at least riding on the airplane while we're building it. And you know, it's hardly seems real to me that it's been a little more than 6 months, almost 7 months now, since we closed our lunch programs, I think on the 16th of March. And so that's probably the thing I'm most proud about. I'm also very proud about the creativity that folks here have shown, looking at different ways that we could stand up services, modify services, change things. Most recently, I think the thing that we've done most recently really is a grocery shopping initiative funded by Mayor Romero and the Tucson City Council that's allowing us to provide hundreds of people literally with grocery shopping, personal hygiene and household cleaning item shopping. And that program came up very quickly, and it's one that we are really, we're very proud of. We're proud of our partners at Lutheran Social Services of the Southwest, who are actually doing the work. And so that grocery shopping program has been great. I'm also really proud of the way that we've continued to expand services, especially on the meal side with our restaurant program, where we're now providing delivered meals to, or grab and go meals to, like almost 1,700 people. And that's an increase from about 1,100 or even just 1,000 meals in February. And so that's been a major initiative. Also, our great partners at Catholic Community Services, Lutheran Social Services, the City of Tucson, and a whole host of apartment complexes that are really places where large groups of older adults are living. The folks operating those programs, and our kitchen, Stay Naked Kitchen, and the Cafe at the J, operated by the Jewish Community Center.
Yeah. You know, they say you never know what you're capable of doing until you have no choice. And that's kind of what the last few months have been for us. That regarding home delivered meals and grocery shopping, if people are listening and they're aren't receiving one of those and would like more information, I assume they can call our helpline to get more information and see if they qualify for those.
Sure, I think that's 790-7262.
I was testing you. You did good.
And also, they can also go to pcoa.org. Our helpline staff are, checking emails and responding in that way too. So that's great.
They've been really busy lately. So yeah, but please don't hesitate to call if they can help. So what new and exciting things do you think the community can expect to see from us over the next 6 to 12 months?
Well, I think one of the things that we're very excited about, we've had this new federal initiative related to Alzheimer's disease and other dementias that we're calling Dementia Capable Southern Arizona. That's going to allow us to hire 4 or 5 staff people and dramatically work over the next 3 years to increase the capability, not just at PCOA, but I think throughout our caregiving community, and actually throughout all of Pima County. We're hoping to build I think it's a dementia-friendly plan for the county. We're very excited about that. That's going to be a lot of work, but it's something that many of us have wanted to do here for a number of years, and so that's great. Another thing we're doing is, we opened our Katie Dusenberry Healthy Aging Center facility in November, almost, just a couple of weeks shy of a year ago. And then 4 months later, we basically closed it for outside programming because we were concerned we wouldn't have enough staff capacity to keep both of our facilities home as we send 80% of our staff home to work. But we're committed to trying to sort out and operate healthy aging programs in the virtual environment. And so that people should continue to be watching that. I think we're building out a new website that's going to make a better platform for us to use. We've gotten some new modifications to some of our longtime programs, which are going to allow us to do them from a distance. And then we've also launched, and this is something so new, I don't even really know a lot about it, is our social connectedness, our social connection network, where we've got 2 groups of people, a wide cross section of people interested in older adults, isolation and loneliness, which we know have terrible health consequences, are coming together. And I think there's one group that's looking at how do we help people be together physically safely, and then how do we do stuff virtually. And so that's another area where I'm really excited about what's going on and hoping to learn more about it myself, and to see what's going to happen there.
Sounds like there's a lot of really neat virtual opportunities, and I look forward to seeing the virtual Healthy Aging Center and what that holds for everyone, and to see what these groups do. So that's really exciting. And on a virtual note, that we're just finishing up our first full season of PCOA Voices, and we plan to take the holidays off, and we aren't sure what'll come next yet. We need to kind of figure out what the needs of the community are and how we can meet those virtually. What are your thoughts about how this PCOA Voices thing has gone, and how you see us using this kind of digital format in the future?
Well, Lisa, I think the most important thought I have about PCOA Voices is that you have done an amazing job hosting it. I know that it's added, probably more than a day a week to your workload, already stuffed and jam-packed workload. I did get a call from, I think some people at, I don't know if it was MSNBC or CNN, who knows, maybe even Fox News, wanting to know if we could make you available to there to fill in for one of those people, who knows who. I told them no, that we had too much stuff for you to do here, and so we weren't letting you go. But in all seriousness, you've done a great job, and I know because 300 to 500 people are watching this, each one of these episodes, that this will be the 10th one. And I think we really are trying to see what is going to be what will be the new year, what will the new year bring to PCOA and PCOA voices. You know, this last 6 to 9 months has been just one unexpected thing after another. As you know, 2 days ago here in our Lupu building, one of our very large interior glass window walls just spontaneously exploded, so it's just like a thing a minute in terms of what's going to go on. I'm certainly assuming, and we're starting to see some press about this, that we're going to be primarily virtual, although still open for walk-ins, but primarily virtual, certainly with our workforce really well into the spring next year, if not further. And so there's going to be a need for us to continue to be connected and to figure out how we expand and increase our capacities in these virtual digital ways. At the same time, trying to figure out what are some other safe ways. And so that's what that great social connection network is going to be helping not only us, but I think the whole community think about those issues.
Well, I know you've really embraced all these virtual digital opportunities, and it's been great to have your unwavering support for PCOA voices and these other platforms. So thank you so much for your leadership and your support and your kind words, and for being back on the season finale. Well, I'm so honored to be here, and so appreciative again of all the great work that you and your team have put into this, and all of the people that have been putting together tips, and all of this stuff will still live on our website, so people can go back and watch episodes and check out those tips and get the information. So it's certainly taken a village to put this together. So thanks again for your support and for being here. Sure. Don't go anywhere. So now a final reminder about Medicare open enrollment. Now we have a segment from Tina Marie Higdon, the coordinator of our Medicare team.
Hi, it's that time of year again. Pumpkins, costumes, hope for cooler weather, and Medicare open enrollment. Every year, Medicare open enrollment starts on October 15th and it runs through December 7th. This is the time of year to take a good look at your Medicare coverage and decide if your current plan is still meeting your needs. Are you turning 65, or do you just have questions about Medicare? There are many places that are advertising for free counseling through their sponsored plans. But here at PCOA, we have Medicare SHIP program with staff and volunteer counselors ready to help. We're not affiliated with any plan, and we offer completely unbiased counseling services. Please call 546-2011 if you would like to set up a phone appointment. And we also do counseling via email. We offer a webinar every Tuesday afternoon at 1:30 called Understanding Medicare. Please see the PCOA website for the current link to join these presentations with a Q&A session at the end. Along with the SHIP counselors for Medicare, we also have Senior Medicare Patrol, or SMP. There are many different scams going on, especially with the pandemic. The best piece of advice that I can give you to protect you and your personal information is this: do not share your Medicare number with anyone that's not a trusted contact, such as your healthcare provider. The scammers are getting very crafty. They're posing as Medicare agents, Social Security personnel, and even selling durable medical equipment online and on television ads. Please call your local SMP office if you have any questions or believe that you've become the victim of a scam. Our number is 546-2017. And please remember, only you can prevent Medicare scams. Thank you.
Thank you for joining us, Tina Marie. I know you and your team of staff and volunteers will be very busy the next several weeks with Medicare open enrollment, so take good care of yourselves. And all of you, please take good care of yourselves as well. Remember, if you need help or you have questions about services that we offer at PCOA, please give our helpline a call, 790-7262. Well, that's the end of today's show and the season finale of PCOA Voices. We'll let you know what we've decided to do next. We want to better understand who's been watching and what is most of interest and help to them. So I hope to see you all again, and thank you so very much for tuning in. You know, this show has been a journey for me as well, and I've learned a lot over the past 5 months and 10 episodes. I think it's really helped me to cope with the stress of the pandemic and social isolation as well. I want to give a big shout out to the creative and technical team of folks at PCOA who have worked hard behind the scenes to make this show possible. In particular, Lana Baldwin, Shane Lynch, Adina Wingate, Victor Quiros, and Jan Baker. And another big thanks to my friend Jay for the theme music that always made me want to dance. So until next time, everyone, be safe, reach out for help when you need it, and let your voice be heard. Thank you. Bye-bye, everyone.